and Maggie for joining us. My understanding is that Roger has to leave early in the meeting, so I thought that maybe what we could do is start with the municipal broadband budget, and then we can go back in order and go to the health center if that is, folks are amenable to that.
Okay.
All right, Roger, do you wanna?
Shay, I'm happy to. Can you hear me clearly?
Yep.
As you know, the way the broadband budget works is that the town budget pays to maintain the infrastructure in good working order, and the subscriber fee pays substantially all the costs of the connectivity, the actual internet connectivity for the users. So I can walk through this once you get to it. It's fairly close to last year's budget, and there are just a few changes. So there we go.
Yep.
Okay.
So the budget follows along. There's $6,000 allocated for the administration in the town office. That's for Tina. There's some power that's related to the power used by the central office building near the town office parking lot. Janet asked that we double the budget for the postage and so on for the annual billing. That is $700. The propane and fuel oil, we tend to not use very much of it, so I'm keeping that the same. I've suggested that be the same. There is some money set aside, $5,000 a year for repairs to the truck, which is now some 15 years old. Did need a substantial repair this year, and any other of the physical equipment, the generators and so forth. Now we get into the cost of leasing from CMP for the subsea cable. That is in here this year at $15,250. It does have an escalator clause, but this is pretty close to what it will be this year. We also pay CMP and Fairpoint or Consolidated a per pole fee to attach our cable, and that's $19,000. Then we get into the cost of GWI itself, and you'll see that there's a $98,000 charge, a $137,000 charge, and a $58,000 500 charge. The $98,100 is what they call the management cost, the management overhead. The $137,116 is a per subscriber per month cost. We currently pay $15.87 per subscriber per month. That's what this is. The $58,500 is the cost of the actual internet traffic that we are using as a community. That's $58,500. The liability insurance line is $10,000, and this is a mandatory. It's set by the PUC that we must have a $5 million liability insurance coverage for our pole attachments. It's grossly unfair, but it's the law. So we have to pay $10,000 for that. And then the final item in the budget is $35,000 for repairs after storm damage or the lines coming down or what have you. And that has been tracking fairly consistently year to year. The net of this, because we have a few more subscribers, is that the town subsidy, after accounting for the subscriber fee revenue, the town subsidy is going down by about $1,000 this year.
That's great.
Let me just also say that in this budget, there is this other column, and that's the column, it said at $33.95 per. And just let me say that this is the column that the broadband committee is working on negotiating with GWI at this point for considering a new contract, and none of these numbers should be thought about as cast in stone. So we just got, John and Laura and I just got a copy of the proposed contract. We're not at all sure. We're going to recommend to the select board that they approve that contract for the vote by the voters at town meeting. There's still quite a bit of negotiation to be done. So I'll leave it at that.
Okay, so you feel like, despite the fact that you're having your ongoing contract negotiations, the FY25 budget is what is recommended and what you feel like we will need in order to keep a consistent service over the next fiscal year.
Yeah, and it would only be lower. If we can negotiate a better price, then it will actually be better for us if we can get there and the town approves it. So I'm confident that it won't be higher than this.
Okay. Any other questions for Roger?
What's the current app per? Is the per person or per monthly or whatever, the $33.95, what is that for this year?
The current for this year is the 98,100, the 137,116, which is $15.87 per subscriber per month, plus 58,000. What we've said to them in the negotiation is these three line items are unacceptable, and they have to give us a consolidated price of per subscriber per month. We're not paying a separate overhead fee. We're not paying a separate bandwidth fee going forward. And they've come back and proposed $33.95, which is essentially just about what we're paying, and we haven't accepted that yet.
Okay. Thank you, Roger.
Any other questions? All right, perfect. Thanks, Roger.
Thank you, guys.
Thanks, Roger.
All right, now we'll take it back in order and take a look at the health center budget.
Broadband.
You just did it?
Yeah.
Oh, okay.
Well,
Okay. Well, I-
oh, sorry.
My timing is great. You have to go spend time with Fred. Can I stay?
Yeah, absolutely.
That's some pizza. We have food here. Owen, did you smell the pizza?
No, I'm fine, thank you.
Owen?
Right.
Or-
Thank you for the offer.
So starting at the top, I don't know, Dory, Janet, Ellen, who wants to
I can
kick us
start,
off?
yeah, I
Great.
can start. Because my part, I mean, especially the payroll. As you will see, I've given, cost of living of 3.25% to the providers, so that comes to 376,914. Lisa Hilt, transcription administrative assistant. Cindy Satchfield and Peggy Pike still might do some work, but that's their line. The line that's blank said Beth O'Mara, that was when she was just beginning. So that's why she's now up on her own, up in the contracted salaries. Custodial services stayed about the same. Substitute coverage, I'm pushing up each year, seems like, I know. But, to date, we've already spent $70,785. And that's something that Dory or Owen could speak to, the need for that, but it's, and I think she has it itemized. Each provider has X amount of days for, training and for vacation time, so that's basically covers. And then the medical assistant. Dory, do you want to say anything about, or do you want to ask her anything?
I would be happy to talk about the substitute coverage. That includes vacation time, which 2 of the 3 providers have 21 days per year. The other provider has 14 days per year. And that comes out to about 56,000 just in vacation time. That vacation time is significantly less than most other veteran providers have, but we're happy with that. It also includes the continuing education for the 3 full-time providers, which comes out to be about 8 days per each provider, and then 2 or 3 days per year for the other 2 providers. That includes our mandatory continuing education for our licensure. Also ACLS, which is Advanced Cardiac Life Support, which is every 2 years, Pediatric Advanced Life Support, that's every 2 years, Advanced Trauma Life Support, that's every 4 years. Those are the major conferences. And then it also includes 2 clinical days per week for Dr. Kramer that she sees patients. So, that has grown over the past several years. As it has become more busy, and it's impossible for providers to really cross cover to any extent because the weeks are just increasingly busy.
Same story.
You're welcome.
It's 2 days a month, per month,
2 days per month?
per month.
Yes, 2 days per month or 24 days per year. I'm not sure if I said that correctly.
Any questions on that section? All right.
Going forward to fringe, FICA is 7.65% times the budget. Health insurance went up, well, it went up 4% anyway.
We're only budgeting for a 4% increase,
Yeah,
and that's, have we heard from them? That's adequate, seems like pretty
yeah,
low
that started in
increase.
January.
Oh,
And that they go January to January. That's why sometimes my years, I have half a year at one rate and then not half a year. So I never plan it. I never get it exactly right. Then something might change or somebody.
Yeah.
So that's why that is up. And the retirement is about the same. Utilities, they're about the same. The answering service is big messages. That's that I think went up a little. So I thought the 6,000 would cover it. Supplies. Something I dropped, equipment repairs, after going over the rest of this budget with Dory. I mean, we left supplies the same. Equipment repairs, we dropped that a couple $1,000. The purchases, we left the same. The big change here is the service contracts, that includes Azalea. And that is our billing system that started out as billing, then we've added on electronic health records, a couple other things, which transcribing, e-prescribing, dictation, things that were separate things before, separate lines before, like, transcription with a separate line for $12,000. So now that's included in this Azalea, so, and so you have a page here that I've, written up, the health center contracts, kind of a breakdown. So Azalea for a year is going to be $42,000. Then we have independent practice services, Carrie Kirk. I'm not sure if you all met her when she was here for a week. I don't know what time, if it's at the end of last year, but she's, a professional, in rural health centers and has been coming in and helping us get accredited, updating records, helping us with billing, helping us, changing codes, to receive a higher rate of return, on revenue. So for her this year is, she said 28,000. And then Maine Medical Center, clinical engineering service agreement is $1,000 per year. So that's what makes up that 71,000. Operational supplies are left the same. Circulation material left the same.
Can I just ask a question? So the only lines that we had in last year's budget from that $71,000 was the transcription line is zeroed out. I see. Were there any other, were there any other lines that were zeroed out as part of?
I don't think so. Dory, how were you doing e-prescriptions? Were we
No.
paying for it?
No, we were not. So, I mean, originally it was dictation when Peggy worked, and then we switched to transcription, and now it's all included in Azalea. The benefits of switching to electronic health record is that our documentation and coding is more complete, and our reimbursement has increased per patient visit, and also that will be reflected on our cost report. And we've already seen return for our investment in using Azalea. Carrie has negotiated a couple of the contracts with insurance companies, and will be continuing to do that. One of the big barriers that we've had in the past is getting the Medicare Advantage plans to reimburse us. And Carrie has dug into that problem, and that has been remedied. And with our increased cost of visits, we've also implemented a sliding scale fee that goes up to 350% of the federal poverty line. So if people have a high deductible, they can apply for the sliding scale fee, and based on their income, they can have a visit as low as $5, $10, $20. So our goal is to optimize our reimbursement from insurance by using the electronic health record, electronic billing and coding, and not impact the people that are uninsured, underinsured, people with high deductibles. So we have seen investment on that. We've seen return on that investment, and that will continue to improve. And we should also need Carrie less.
Not you,
So that $28,000 a year should continue to decrease over the following 12 months, the next fiscal year anyway.
And I just wanted to add, in that 42,000 for Azalea, this year we added 6,000. This was Beth O'Mara, who's been in, had to do a lot with them and dealing with Azalea and working this through. She's adding, or they plan to add, integrate lab ordering and reporting, which will cost an additional $4,200 a year, plus an unknown amount in implementation fees, and we add 6,000 to that. Will that answer your question?
Yep.
So next is mental health. So I heard, I wasn't at the last meeting, but I heard about from the school that they were not going to, budget any money for this. So, and I think the new rate was, well, community fund recommended was 70,000. Then Carrie, I missed that message about the 75. Then I went back and changed it. Anyway, we would only be paying for this in this first year, from February 1st through June 30. So that's why I have 31,250. So that's based on the 75. So.
And we've also made progress in getting Dr. Wright credentialed. And he will be billing under the health center for patients that have insurance.
Is Dr. Wright the second provider that's coming out for ICF?
Yeah.
Okay.
He said no.
So this
No.
35,000, excuse me?
For the school?
No,
No,
Did you say, I thought you said the school.
no.
My apologies.
So out of the 75,000 that we were talking about, this 35,000 is coming out of that? Or in
the
addition to?
31,200.
Well, it winds up only being half the fiscal
5
year,
months.
right?
No, I know, but we put it into a different line, and so I want to make sure that it's not
Oh, well, this is-
$100,000.
No, this is the mental health line. You said a new line, but we already have a mental health.
You
line.
know, so Janet looked at what we had done last time and thought that the health center was the appropriate place to put it, so
Right,
took it out of the line from last time and changed it to this amount. So
Right.
it was
I'm
being
sorry, I
realized.
didn't read anything
yeah,
on
and
that.
let me explain that too, because I did talk with the auditor. I didn't want to increase the health center's budget by $70,000 or 35. But I talked with her, and as Dory said, we may, and we hope to receive some revenue from this. So the auditor said if the revenue's coming back to the health center, then the expense should show there too.
Okay.
So that's why.
No, that's cool. I just completely missed the part of the conversation that we
I
were.
didn't tell you, it's. See?
Well,
No.
we're all playing secret squirrel with
Yeah,
it, then.
no, I was working on that when I got back from vacation, but I did talk with her just to say, what do you recommend, so.
So then will the budget line change to go,
The health center's budget line? Well,
the 2565? Because we had recommended
you recommended
75,000.
75, right, but what we're budgeting for will only be, this won't take effect until next February. That's what they are willing to pay it through February 1st. So we're only paying from February 1st, 2025 through June. 5 months. If it was for the whole year, if we were starting July 1st, it would be 75,000. Okay, and that'll be interesting to see what we do receive for revenue from Dr. Wright.
Because Emily Davis is also, Carrie Turk is working on getting Emily Davis credentialed as well.
So, does that answer your question? You look,
No, it does. I'm just trying to figure out. Because if we're paying through. I want to make sure that our lines match what theirs are, and if theirs don't jive with our June to June and their January to January, because the community fund was asking for 75,000 for. And now I don't know if it was the fiscal year or if it was January through December, and if that conversation's been.
they were asking for, they were recommending 70.
Right.
And that's what it was.
And the select board had this, that we were okay with throwing in 75,
Yeah.
but I just want to make sure that they're not getting shorted on it, because if they were asking for it starting in the letter that I had read, I didn't read it as until February of 25. And so, but there's a chance that I'm wrong with it. I just want to make sure that they're not expecting to receive the 75,000 to continue their contracted services with Emily and the other guy. And then they're only getting 31,000,
They who,
the community fund,
they will be out of the picture.
as of February of
First.
2025.
Correct, so that's all on the town. They won't, I won't be sending them bills and waiting to get their money back and everything.
Am I making sense to you? Or you, since, I don't know,
Somewhat.
you might have the other information that I don't have.
I don't have that letter from her, the request, and I think, you know, I'm happy to reach out to her, have Janet reach out to her between now and the next meeting.
Maria, to me?
Yeah, but so it's starting, so the request for funding was asking the town to take responsibility for the continuation of the in-person mental health services starting February of 2025.
Right, but we're, so they asking 70 from 2025 or 70 for the year?
It's
70 for a year, it would have been for a year.
right, so they've
Yeah.
been spending $100,000 a
A
year,
year, right, was my understanding.
right?
And
So,
so I just didn't know why, if they're saying that they're wanting it from February or that,
That's
Starting
2
in
years
February.
for them, they started in February. When they started this, it was in February, so that's probably why.
no, and that's cool. It's just if she was asking, if knowing that they weren't gonna pick it up until February, or that they were continuing it through February, if she was asking for 70,000 from February to June. Or if it was,
right, that's
the
not my understanding, but I'm
I'm not
happy
sure.
to send her an email to clarify that.
That, that would make it $140,000 a year, for the same, no. They're recommending for a year.
Yeah.
Did you find that letter?
Yes.
Okay, yeah, yeah, what was I gonna say?
I understand the confusion, but, yeah, let's just circle back with it.
Yeah, I mean, I think we can clarify it, but I think, if, assuming the cost of the program is relatively the same as what it has been going forward, I think this should resource it in the same manner that ICF has for the past 2 years.
Yeah, and then they're just out of it completely. They said, I remember when Gabe negotiated with them, you know, and they said they would do it for a couple of years to get it up and running, and then the town would.
I think that can get clarified by Shay and we're good to go. Meanwhile, we can move on.
I will put it on my list of things to do.
Pharmaceutical, we went up a couple $1,000. Laboratory is the same. Immunizations, Dory said, you know, let's take that down to 6,000 from 10. So there's nothing under transcription, that's now with Zalia. Any questions? Travel and training, that's about the same. Ferry fares, I'm pushing up. The operations, for the health and hazardous waste collection, which I swear Jordy's gonna take that over this year. It's accumulating upstairs in the attic and boxes, so. Do you have anything to say about that, Dory or Owen?
No, it sounds terrible, but it's actually needles that are contained in very heavy plastic and red bags, so.
It's a matter of calling the company and having them meet us in Lincolnville. I've done it for years, but nonetheless, since COVID, I haven't done it.
Yeah,
Before
2
that,
or 3.
just put a couple
Box,
boxes
big
in my
box.
car and go over and they beat me. Before that, we would take it to, Penn Bay. For a long time, they were very considerate, and then they stopped. I mean, we would still pay the disposal company, but Penn Bay wasn't like holding. Now it's, the last time I did it, I met a truck on the.
Like I was sight out of way out up there. Dues. Well, but we're leaving that the same. Consultants, this is for the Medicare cost report. And it says the rest of it's under 2514, which is Azalea. Because some of this will be Azalea, some will be Carrie Turk. I think she and Vern are going to get together when she's here in the spring. I think he'll come over and he will, and they have been talking quite a bit anyway about the cost report, and she taking it over from him, which she's very grateful for. Malpractice and liability insurance, 26,000. The supervising doctors, an increase of 3.25% for them. Then any questions about any of this? Contingency, leaving at 20. So that brings the total to $1,133,672. And I haven't, we don't know yet from the auditor, what, if any, if the health center has any undesignated fund balance that might be used towards this, but, the revenues that I anticipate are 170,000 for health center revenues and 60,000 to come from the endowment, leaving a subsidy around $903,672. But again, I'm hoping to hear from the auditor what, and the same for us, for the town's budget. She hasn't told us. Last year, the health center had some, and I think we did take 20,000 from it, I think something like that, not a big amount, but
Do you think we'll have that figure before next week?
I hope so. I will bug her again.
Yeah, I think it'd be very difficult to finalize the budget without that number.
Yeah.
How does the revenue of 170 compare to what we budgeted this year?
This year I budgeted 150. So I'm going up, because, as of when I ran that revenue report, we've already taken in $103,610, which was better than last year.
Okay.
But again, I can't finish the health center revenues until I know what that town subsidy is. But
Sure.
we'll handle that. No.
Any any other questions on health center?
So do you want me to find that letter from Maria for you? Oh, okay.
Yeah,
Oh, is it in the packet?
I'll send her an email and.
Yeah, I mean, I can just, oh, it is. I have it, yeah.
As long as that's what it is, and they're not getting, for lack of a better term, shorted on it. I think I'm fine with it as it is, with just knowing that next year we're wanting to put the additional 60,000 or whatever into it.
Yeah.
Could end up being $75,000 next year.
Yeah.
Janet and Dory, it sounds like Azalea is going to ultimately be a real boon for the health center altogether. I'm so glad we're going in that direction.
Yeah, we're so lucky to connect with them. Right, Owen, you love the electronic health records?
Well, I like Carrie.
Yeah.
Carrie's good. And the health record is what it is. I mean, the health, EHR is what it is. It's probably as good as any of them. It's just a different way of practicing medicine, but, I think, it's a lot of money and we're really hoping we can, recoup some of the revenues, so, because it's not gonna go down, and we have to find a way to bill all the insurance companies so that they can pay what they deserve to pay.
Our billing system has really been antiquated. Rhonda did her very best, but everything was manually submitted, and I think we're going to see a significant improvement in our revenue moving forward and on our cost report. And also it's going to drive our cost of delivering care rate up. So our RHC rate will increase, which means our Medicare reimbursement will increase, main care will increase, and even reimbursement from Medicare Advantage plans, which is significant. So I'm hopeful, but it's been a lot of work, and especially with main care, our main care reimbursement is in arrears by many months because of a change in the billing structure. But Carrie's been very helpful, and Beth also spent countless hours during implementation and continues to help support us through all of this.
She's a rock star.
Frank?
I just asked a question about Azalea. Do they get a flat rate or hourly, or do they get kind of the more money they are able to recoup for the health center, they get a percentage of it?
They have a monthly fee that includes hours of consultation for this contract.
Each suite that they have, they offer different things, and each suite has its own price.
Oh, I thought you were talking about Carrie. I didn't know if you were talking about Carrie or,
Did you say Azalea?
Yeah, you said that you had someone helping for billing, right?
Well, Azalea is doing our billing. It's a company that it's in,
Right, I was just wondering if any of their compensation comes from a percentage of what they actually recoup for the town, or if they just get paid.
they get a flat rate. Because, they get a flat rate. For whatever you choose, like prescribing is on here. It's different suites that you can buy. They're always sending out something. Oh, we offer this now, we offer that.
Azalea's not actually doing the billing. They're just the platform that we use
Oh.
through Brandy and then through, Terry. Isn't that right, Dory?
right, it's more for the coding. So we enter the documentation for the note, which includes the ICD-10 codes and the CPT codes. That all goes into Azalea, and then Brandy goes and looks at those, and then it gets entered to Trio, and Trio sends them out to the individual payers.
Yeah, hope that nobody's getting a cut. We're not big enough. It wouldn't be worth their while.
Yeah, I figured, I didn't know they were gonna flat rate plus a percentage for what they recoup for the town, almost like an incentive to try to.
There were some companies that did that when we were.
One in Belfast story that would do that.
Right. Athena, like Athena charges, I think 8 to 10% of your billing. But we're just such a small practice that they charge us a flat rate for each service they provide that we utilize.
Great. Is there any other questions about health center? Thank you, Dory. Thank you, Owen.
Thanks, Dory.
Thank you.
Thank you, Dory.
Thanks, everybody.
All right, should we move on to unclassified? Great.
Let's go with Memorial Day. That's for buying flags and wreaths, the flags that get put on the graves and the wreaths that we place around town. And then cemeteries, it's up this year. Cindy Gorham put a request in for $9,500. Due to increase in labor costs and the level of expertise required, rules out the use of volunteers for tree work, grave site maintenance. They want a site for a storage shed. They'd like to find someplace to place a little storage shed to put their materials in. So, that's why that's up. So in unclassified insurances, it's FICA based on the wages. Health insurance costs are up 4.25%. Excuse me, I think I said 4% earlier. Workers' comp 15,000, retirement 30,000. the wellness program at the health center, which we pay half of that and the health center pays half yearly. Hasn't been heavily utilized, but, it may pick up. Unemployment, 2,000. The risk pool is the same. And the airport is for liability insurance, that $2,500. And then the auditors, they said it would probably be about the same as it was this year. Any questions?
A couple weeks ago, we came up with the idea of covering the cost of the wreath at the White House.
Oh, the Christmas tree?
Yeah, is where.
They do that themselves. I don't know.
Well, right, but
But they pay for it out of their own pocket,
Right.
not out of their budget,
Someone's donated it usually.
not the past 2 years.
Yeah.
Ken and Rachel paid for it out of their own pocket, and it
Oh.
costs a couple $100.
I just wasn't sure if this is where we would think about that, or if that would be under a different.
Now that would come out of the museum budget.
Okay, that would. Cool.
Yeah, this is just Memorial Day. That first
Yeah, it's just
one
the
week,
wreath line that caught my attention.
yeah.
Maybe that was it.
No, those are the few wreaths, the laurel wreaths that get placed at the library and used to throw one off the ferry boat. I don't know that they do that anymore. But then one at the, from the point on the anchor.
Any other questions on unclassified?
I'm just curious, what is the wellness program at the health center?
It's like a split. If the fee were $70 to employee would pay 35 and the town would pay 35. It was like a 50-50.
Okay.
And I think that's for 3 months. 3-month period.
Oh, for the gym?
Gym for the
Okay.
fitness.
Fitness center?
Yeah.
Okay.
And it was a big thing a while ago, maybe during COVID or before COVID, trying to get the firemen to go there, this was, I think, Dory or the health center kind of started this, trying to encourage them to go there. So this is a way to make that happen. And a little bit people do still. Always the best.
Oh, he's going.
Anything else on unclassified? All right, capital reserves.
All right, capital reserve, you see, it's pretty blank. I'm not sure how you're feeling about that this year. I did put in 20,000 for Dark Harbor wastewater. We have some stuff going on there. It's going to go on, and I want to make sure we have money to be able to do that with the system. So I don't know if anybody has any thoughts over anything in particular that you want to increase or put in, like, we will be paying off the solar salt shed in the town office. I think it's in April. That was my payoff date, I think.
And the balances that we have from this year will cover those payoffs.
Correct. So then that will be a zero balance, but we don't need to do anything there. I don't know about ambulance or fire, if anybody has a strong desire to put, more money in there. Mert hasn't really said anything to me. Emergency ferry trips, I think we're all set. There's, some money in the Up Island Fire Substation. That's been there for a bit.
Is the Up Island Fire Substation, is that's separate from the Up Island
No, it would.
garage? That
would
is
be
part of the money that was raised for the municipal building project?
I think this was something separate, Mert, right? In capital reserves, there's an Up Island Fire Substation, which has about $17,000 in it. That was something that, I'm not sure when that was started.
Well, that was the early thoughts to put money away for in the future.
Yeah,
That was started way before the committee.
right, so,
But
So
that is,
it was just a seed money way back when.
but that's money that would go to support the cost of building an Up Island Fire Station.
Right, it was just
it could.
early money for architectural design, concept stuff. And I don't think we've tapped into it yet.
No, that's something that, well, I'll have to look at towards the end of the year. How much has been spent
Right.
on the public safety up island. I mean, that's money I could transfer over to cover expenses that we've had. Or just leave it there.
Right, I just want to make sure that Lauren and her team have that figured into all of the calculations that they've been doing, so.
No, probably
Okay.
not.
Okay.
No, it hasn't been, and I'd be happy to add it to our. Just let me know, Janet, be like a little Christmas present.
Okay. Okay. All right.
All right, Acre Island Public Safety. We started that in FY 18, and there was a little building built over there.
Yeah, again, it was seed money to look in the future for the building that they have now, because what changed was we thought we'd have to put money away to build a little building for some of the equipment, but I was lucky enough to get the people of Acre Island to foot the bill to build a little building. So it's not a bad seed money for upkeep, repairs, just from age. But right now, everything is satisfactory. The building for fire equipment is well better quality than what CMP put for a little shed. That building will deteriorate before we even think about the little building for the fire equipment. And also to know how they got that building material. They took all the blowdowns on Acre Island, and Carol McCulley had a sawmill, made all the lumber from the downed trees. So it's built with real timber. So it's a high quality boat that the boatyard built.
Wonderful.
But we might have to do some upkeep on it, so I would keep it active.
Floats and inclines, there's $30,365 in there. Municipal vehicles for the town truck, we have a standing balance there of $15,102. Police cruiser, we haven't finished paying for a couple things, that's why there's $28,000 in here. Has something to do with radio still, that Fred hasn't been able to get the vehicle somewhere, but that will be going down as soon as that is completed. So road reconstruction and paving, there's $10,000 in there.
Ooh,
Hmm.
a whole 10,000.
But that's a line that we probably, or you all might decide to put something in there. Public works equipment repairs, for repairs is $8,900 in there. Technology, computers, etc. is $22,676. The IMB replacement, their contingency line is, that's why Roger didn't budget anything for it this year. You notice on their budget has $78,000 in it. Sea level rise has $147,234. Public health, the deer reduction surplus went here, and this is money. So there's $7,000 in there. Every year I take out whatever has been expended the year in that line, which it might be $1,000 a year that you have a brochure that Proforma maintains, and they do brochures and websites that they upkeep, so that's worked out well. Health center equipment has $16,291. So the health records electronic, that has a balance of $1,000, because I've taken out $40,000 to go towards paying for Azalea. originally, when we started putting money away for electronic health records, we thought you'd be buying a program, you'd be having to actually buy something, you know, and we didn't know how much, and we just started putting money away. But then when you connected with Azalea, you know, you realize you just basically like renting it, you know, you pay, a monthly fee. So. Building system, building or
Can I
eight,
ask one question about that? So that, $39,000 was used in FY '24, or is that showing up as revenue budgeted in FY '25?
which money?
So it looks like the FY '24 balance, it looks like we've spent the $39,000 from what we had in FY
Yes,
'24,
yeah.
and that is basically showing up as revenue in our current fiscal year.
Yeah.
Okay.
Yeah. Cause that's when we really got going with Azalea. I can't remember when it started. It might have started at the end of FY '23, a couple of months, and it was maybe 2,000 a month, and then we started adding all these other things to it. So the building, any system aging, $42,844. The reval, that had been there, so there's $200 left in that. Future project has $1,709. Library equipment and repairs, which I did use this in the past for elevator repairs, which are costly, has $17,265. So, and attached, I mean, you'll see there's other, the ones that I showed the balance were ones that we had used in the past, but there's, if you look at the back page there's more. A grant writer, we have a grant writer, which has $50,805. It's in this second page of like that.
Oh, that.
Yeah, the month, this is February 29th, sub-accounting.
Okay.
So,
Great.
I'd say sea level rise is the winner.
Is the winner?
Yeah, has the highest, has the most money. The sea level rise when I pave any roads.
Right? Well, I was gonna ask for more money for it. I mean, I think as a committee, we talked about putting another $20,000 or $25,000 in there this year, just recognizing that. I mean, I sat in very briefly on that FEMA webinar today, and, you know, it sounds like to get some of those money, they would be looking for a 10% match. Certainly for other grants, generally the match requirement is higher, and so having that money to match, I think just makes us competitive for the infrastructure funds coming down the pike. And then, yeah, I think we need to put a chunk of money aside for the road reconstruction and paving. Feel like the total dollar amount is difficult until we see what the bottom line is, but I mean, 200,000, 300,000, and I think I'd rather put the money aside rather than have to have a special town meeting because there's been a big storm and we need money to reconstruct the road immediately.
I know the dirt roads on coves are killing us.
Yeah.
On the eastern side. But, yeah, no, I figured you would want to, 'cause, I can't remember from Public Works, what we put in. If I was here for that meeting or not. But, I mean, we'll see it when we go back. So.
Folks have a feeling, preference,
To add more to it, but
more?
I would suggest it, absolutely.
I agree. Thank you, Pete.
Keep track.
For the road,
Yeah,
yeah,
But we also need it in the sea level rise so that we can be competitive in obtaining large grants that are out there in the future. I'm not saying it correctly, Shay, but you can fix it for me.
Yeah.
No, I mean, I think there's a chance that we could get, you know, maybe some of the Narrows funding and some of the East Shore Drive funding covered through FEMA grants if we have enough matching funds to apply and.
Yeah, we figure out what would be for next month. Just it up there. Right, so we need that fresh one.
I'm sorry, I couldn't hear you, Pete. I think,
No, I don't speak very clearly. No, we're just saying, if it takes a certain threshold to receive a FEMA grant, it would be maybe smart to get just enough into that account so that we become eligible. But I don't know what it would take to figure that.
Did you say 10%?
I think that's what they said during the webinar today. Did you sit on the webinar by any chance? I thought Fred was going to. Do you know, this is a big unfair question. I know you guys pulled together all of the information about damages from the storms that qualified. Do you have, is there like a ballpark dollar figure?
Yeah.
Okay.
I think I added in that Lorena's Cove amount to Fred, the estimate that I got from Gartley Dorsey, so.
It's good.
Is it
Yeah.
possible, like, add a line that covers all that, but that's for like FEMA money or disaster recovery of roads or sea level rise or something caused by something that you guys can start a line item on? And then you can, so if it's a road thing or a cove thing or raising the road or whatever, and you need to come up with a certain percentage to match. It's not a, hang on, do we have enough in that one? It's kind of a cover all of preventive disaster recovery.
Yeah, I mean, I think we've done a little bit of that. The road reconstruction and paving has been kind of a mix between doing it's basically been the storm recovery and paving lines. The sea level rise has been a new line envisioned for the larger projects when we had hoped that we would be doing proactive engineering work. And so we find ourselves in a position where we have a combination of both happening. I think it still probably makes sense to keep them separate for right now, recognizing that, you know, we could likely, depending on the circumstance, we could pull from either line.
Are you
yeah,
envisioning?
I think it allows us to keep the two aspects of what we need to do on the island clear in our heads too. There's the long-term big projects that we're going to have to get grant funding for. And then there's the ongoing, you know, storm damage and road work. And lumping them together, I think may confuse us, well, won't confuse us, but confuse me maybe, but not you guys. It is a good way to keep clear on those two different ways, two different paths.
Are you envisioning using the sea level line as the grant match line?
For work at the Narrows, yes. But
For the
there's,
FEMA- for the
but
FEMA
there's
grant?
lots of different, I mean, I think the FEMA grant could cover lots of different areas around the island. It's pretty multifaceted, so, I think I would recommend kind of putting $20,000 in the sea level rise engineering and putting, I mean, if we want to see a truly horrific budget, putting $400,000 in the road reconstruction line this year, and we can look next week at how bad that looks.
Yeah.
So that does grant a little bit more towards what Frank was saying, with that if there was a separated line out that we were also just building for disaster recovery, using that as the FEMA compromise line, or can, the 10% line, and start putting money into that, because that way, if all of a sudden we do have to spend $200,000 off of the cove that she was just talking about, instead of being able to show that we had $400,000, we're only showing now that we have $200,000 for fund matching. So I don't know. That's what I'm wondering if.
It also, as long as we can prove that we spent the money, some of it could be retroactive. So I think
Okay,
like
cool.
for a specific, I think it's still too
That makes
early
more
for a
sense.
specific grant. I think,
Okay,
I'm just hopeful that if we put money aside good things will come.
No, I was looking into a handful
I
of.
just want to clarify, I wasn't necessarily saying taking both those line items, putting together as one. I was saying instead of maybe trying to figure out how much to put in this one, how much to put in that one, since we're having disaster and matching funds, like kind of a disaster matching funds category that can be used to help supplement the others, or say FEMA wants 10%, it can come from that line items, whether it's a sea level rise thing or a road washout.
Yeah.
Without, I don't know how you guys move $100,000 from one line item to another, if you have to, you know, if it goes from sea level or something, if it has to have a special town meeting or not, just a catch-all line
Yeah.
for that specific get grants and funding.
Yeah, no, I think that the way that the lines are currently structured, as I understand it, is that I don't feel like we would, I think that we would be able to use the funds without further,
We just have to tell them we have $300,000
right,
and not necessarily show that it was budgeted and where it came from, and then be able to pull from the lines that we need.
Yeah.
Gotcha. My one, I went into a rabbit hole of mental health grants. And you have to show that you have previously been putting away and subsidizing for it, is one of like the Advantage Health grants and stuff like that. They'll match you, but they want to see what you had in the bank account for it,
Right.
you know, not, ooh, we'll put it in, but they wanted to see that you were trying to build your account previously. And
Right.
so that's where my concern went. Ooh, maybe not.
So do you want me to pencil in 400?
How does that feel?
And
How
then
does
we
that
can
feel
come back to it,
to
we
people?
will.
It seems like we're only gonna be facing bigger and bigger issues as time draws on, so if we're looking at 175 for Loranas alone, that's almost half of that.
And I'm hoping that perhaps this can happen before the end of this year, and I've talked to the auditor about that, since it's from storm, and we may get some FEMA funding back from that, but, undesignated fund balance will cover roads over counts that are over, so if that could happen, then it wouldn't affect this budget going forward.
Right, but it doesn't change the fact that we'll have more storms and we have $0 to
Right.
cover.
Right.
Yeah, I think let's put in 400, and I think our full review is we'll have to make some difficult decisions, but I'd rather start with what we feel like we need, and then we can, yeah.
Get the old red pen out.
These are made by True Red,
Oh.
but they're not red.
Oh, I'm also just recognizing his 6:04, so, let's, are people comfortable with putting $20,000 in the sea level rise line?
Yeah.
Need a motion, Shay, or just wanna?
No, I just wanna
agree
make sure
with
that,
that.
I don't wanna do that without,
That sounds great. I'm with you on that.
are there any other lines that people feel like we need to add to? Okay. Let's keep on trucking then, debt service.
All right, debt service to broadband, the principal is, this year going forward is $170,000, and the interest $93,837. And the next one down below, where, municipal building project, last year I had anticipated borrowing that 1.75 and not knowing for sure when we would do it in the spring or the fall. But in talking with Vern, we talked about having at least 45,000, probably would be interest the first year. If we go in the fall, the first payment is not until springtime. And it's usually interest, then that fall it would be the principal and the interest. So what's going on now, I can't tell you what to think about, what to do until.
Well, we would be unlikely to. I guess, Lauren, I'd be looking, I mean, it seems like we should at least probably budget interest again.
Yeah, because I'm planning to do the fall municipal bond bank, and I just emailed the lady there, Tony, read. She really can't tell me anything about interest until I would tell her, and it's so hard to know, if you're not doing it until September, what the interest rate might be and how much. So that's the two things I would need to find out, but yeah, and Marge had said that just let this 45 fall into undesignated fund balance. And then just if you need more, budget more for this year coming up. Said I can't really carry that forward, that 45.
Okay.
It's always good to increase undesignated fund balance.
Right. But you feel like, I mean, do you feel like $45,000 is what we should budget?
Well, that's what we were thinking for 1.75.
Has the interest rate changed at all from then to just even now?
Oh, I'm sure. I haven't, and I think we got that figure from Camden National. But if I can try to find out, but it's, yeah, it would definitely be, 45. I can try and find out, but it's like, it's like a crystal ball. They won't tell you.
Right. Even if we can just gauge it off of what right now's interest rate is, at least, and if it went up dramatically from previously, then we'll at least have more of a ballpark of what we're looking at.
Yeah.
Right,
I
I mean, I
just
would
need-
anticipate if anything, it would stay the same or go down.
Yeah, I can ask her what the rate is now.
Yeah.
And
Yeah.
you,
That's the
Lauren?
municipal bond, correct?
Yeah,
Brandon?
through the bond bank.
Yeah, and we were also talking at one time about borrowing from Camden in the short term, so.
Yeah, that would have been a bond anticipation note. Yeah.
that
All
would be-
depends when we need the money.
Yeah, yeah,
okay,
But I can find out from her what the interest now and just.
and you'll, between now and the next meeting, you'll plug in a number there?
Yeah,
Okay.
yeah.
Any questions on debt service? Okay,
And contingency, I'm leaving at 30,000.
revenue. The station charges.
So if we look at this, the health center and broadband, I put them on here with this, but they're not included, just to remind you all. They're not included in the health, in our budget that we're, revenue, because they stay with those accounts, the broadband money stays there and the health center stays. So I haven't finished that, health center due to the town subsidy line.
But that 170, that 150 should be 170, is that correct?
Patient charges, is that what I said?
170 is what was on the
Oh, I'm
health center
sorry.
budget.
Yeah. This, see, I had a newer budget.
So we'll change that to 170.
Yeah.
Take every dollar we can get.
Yes. I could make it 180. I had a boss once that would just crank up all the revenues and hope for the best. Yeah. I'm too scared. So yes, 170.
Broadband fees are up.
Nice, with more people coming into the planning board.
Even for the fees, you mean? In getting permits? Yeah. Yeah. So did Dave.
Skate park.
State park.
41.
Oh.
So that's
we-
something
yeah.
that comes in and at the end of June or something? We
Yes.
Just don't have any revenue now.
Yeah,
Okay.
yeah. And a lot of these come in, like, I think that, state park money has come in since the date of this, report. And again, I don't know about the fund balance, if we're gonna be able to do anything there.
We didn't use any fund balance in FY 23 either?
No, because it was it about 700,000? I'm thinking that you just felt not to take from it.
Okay. Money market interest, so the money market interest, we have a lot more revenue in this year. Is,
Yes, well, the reason for that is because, the municipal building project money was in our account for a lot of time.
right, okay,
And then it's got its own little now account, so they're
okay,
getting their own.
so it's not something we should count on as a trend with having additional cash to
Yeah.
make us money. All right. Any questions on page 2?
Nothing wrong. Signs, stickers. Auto excise I bumped up to 175 from 150. But that's probably,
And what's the strategy with bottles? Are we continuing to try to encourage people to donate to the junior class instead of
We
taking
were.
it to the health, to the
we
transfer
were,
station?
but I think I told Jeff when the weather gets better to put the barrels back out. But if you'd rather that money, the bottles go to the school, it would save us some money, because it takes him a half a day to take them over there with the truck and.
I just don't wanna tell people not to donate and then budget $8,000 for bottles.
I think the problem with trying to, I love the sentiment of saying, hey, give it to the school. This, depending upon the junior class, every year depends on whether or not they have the capability to even take it on to do the bottles. And so it's not something that we can guarantee every year. Yes, sir.
Just on that, there actually has been some progress with the ferry service in helping offset costs for junior bottles going over. So there is.
No, it's not just the cost of it, it's capability of the families, since it falls strictly onto the junior class families that need to do it. It's nothing that the school takes on. And so all it really takes is 1 year that you don't have somebody that has access to a big old truck. And year before, they didn't, and it was a big struggle that they had. And so, or if those junior class advisors even want to continue with bottle donations, it's not something that the school can guarantee will happen.
Yeah, but I'm just saying there's an offset for the cost, so you don't necessarily have that big old truck anymore, and the cost isn't really being incurred to actually bring them over. So it's actually just. To make it. Getting a vehicle to bring them over, so.
Gotcha.
So I suspect that will help encourage a lot more of it being brought over, because it won't be a cost for them to bring them through the ferry service.
Oh, cool. Free passage?
They're going to, they have some restrictions to it, but they're comping, for the junior class bottles to be able to go over, understanding that they're trying to
Help the.
help the junior class, it's a fundraising.
That doesn't sound like a
That's
state,
awesome.
state Maine.
But we're not supposed to get first in the mouth, thank you, but.
Well, I
it's
mean,
helpful to
there
know.
was some people that reached out and worked on it to happen, but.
Awesome, yeah, thank
That's
you
great.
so much for that.
No, I've never heard anything about that. Is it in the tariff? Hope it gets in the tariff.
Don't ask questions. Just say thank you, right?
Bill, or whoever.
Thank you, Frank.
So it's not a lot of revenue that we're budgeting right now from bottles. It sounds
No.
like we should keep it for right now and we'll see what.
I almost wonder if we shouldn't take it down to like 6. Oh,
Whatever you think.
just that way we're not over planning it.
6,000.
Okay.
6 going once.
Sold.
Senior fees, the local road assistance program, can you speak to that?
Local roads, that is, local road assistance from the state gives us a check once a year for covering, roads. And they've sent, so we know usually how much it is. I've looked online, so it's supposed to be 37,000. This year we received $37,364. And it has gone up a little, but there's no guarantee of, it staying up there.
Right.
But we just have to, there's a form I have to fill out once a year and says, what you did with that money. And I always just say paving usually takes it all. And they wanna know where you did from where to where and, but that's pretty easy.
Okay.
All right, waste removal,
It's gone up a little bit. I mean, it looks like we're already pretty close to
yeah.
making what we're budgeting for next year.
Yeah, the demo is pretty good. I think that will drop down some as, and I haven't had time to look at real numbers to see what the difference, I noticed our, pine tree bill was down a great amount. It was like $8,000 bill versus it's been 13, 12, 13. A lot of that might have to do with John Applecroft. I haven't had time to talk with him to see what his business, how many people he has taking demo to his container. I don't have that information.
We also signed a new contract, so.
Huh?
We signed that new
Oh,
contract.
we did,
Yeah.
yeah. Yeah. So that would be interesting to see. I'm very happy if that's the case. It's costing us less.
I'm glad you added up the donations for the museum.
I come, to the selectmen meeting, we're just finished.
Maybe we're gonna run late.
You're welcome. You're welcome. We're almost done.
Please, come in.
I'm just gonna say, I'm glad that the donations for the museum restoration are sitting at 37,000. We just got the report back for just the lantern room. And it's just over $20,000 for ceiling and just to make it watertight. And so
Yay.
Yeah.
that makes me happy that there's a little bit there for them to work with it.
Yeah.
Okay. Anything? The municipal revenue sharing,
That's what we expect to receive.
okay.
And the homestead around 40. Insurance rebate, we always get something back, 1,000 to 1,500. This year to date, we received 2,500. So that's why I've left that at 2,500.
Okay. Any questions on revenue?
Bring it in.
All right, so will we receive a new packet ahead of next time that has all of the changes reflected with a dollar and a net?
So like what you've added today, you mean,
What we've added today and changes that we've made in the past, just so that next week when we do the review, we can really do an apples and apples comparison about how much the budget's going up and what the impact will be for.
Let me look at, Carrie, gave me some notes. So at the last meeting that I was not here, the library, you added $1,000 to a sustainability program for them. And you asked about, I think, the harbor staff, and I hadn't given them a 3.25% cost of living, but I can go back in and make that. Is that what you wanted?
It was just a question. I
Yeah,
know
I
sometimes
never
stipended
have.
positions are different, so that's
Yeah,
fine. I just
never
wasn't
have,
sure.
but, all right. And the new line for the health, mental health, that I, put it in the health center. And the outreach person, yeah, she did get 3.25% cost of living. And I think that was the only question that,
Somebody had questions about the lighthouse and it was we do pay them an hourly than keeper.
the host, yeah,
Yes, $17 an hour. And since they're doubling their things, that was why they came up with that amount.
right.
There's something else I was supposed to ask a question about that I did and I can't remember what it is.
I see question employee museum, then question, but I didn't know what the question was.
Yes.
It may come up when we go back.
Okay, no, that's fine. I just want to make sure when we go back that we have
Yeah, but I can
a
make,
bottom line comparison that we
Right.
can.
right, and I will get in touch with the auditor and see if she's,
Yes.
can come up with. She's very tiny. Have you ever seen her? It's a little petite thing, but.
Physically. For sure.
Physically.
No, not physically.
Yeah, physically petite.
Okay, with that. Do we need a motion to end the budget workshop? We didn't really. I don't think we can actually make motions in workshop, so I call it over.
Thank you.
Yeah.
Should we take a break or?
2-minute break? Yep.
Recording? Okay, I'm going to.